Hey friends, it's Nurse Alice, and I just presented a webinar, Recognize Early Warning Signs of Clinical Deterioration, presented by nurse.com, proudly sponsored by UNC Health, and it was an amazing opportunity for me to share my 25 years plus of healthcare experience. I am a family nurse practitioner in the emergency room, former cardiac clinical nurse specialist, former critical care transport nurse, former adjunct faculty. I've done a lot of stuff. I've worn a lot of hats, but critical care emergency room is definitely my jam. But not only just as a provider, but as a patient. I too, before RRTs were established, was a patient and, dare I say, victim of failure to rescue. It's where the nurses and clinical staff, physicians, fail to recognize early warning signs of clinical deterioration. I had an allergic reaction to Bactrim, got put on a med-surg unit, isolation, far back unit. Nobody wanted to touch me, right? Because I also had a spider bite, and they thought, oh, MRSA, blah, blah, blah. Anyways, long story short, I was back isolated, and I was there for allergic reaction. I had some pineapple for dinner, and listen, went into full-blown anaphylactic reaction. The only person who listened to me was the lowest person on their totem pole. I hate to use that kind of stuff, but you know what I'm saying, right? Was the corpsman. The senior nurses, the residents, physicians, no one was, oh, she's fine, her stat's fine, her stat's fine. Yeah, my stat was fine, but my airway was closing. And so, long story short, finally, the corpsman did something, went and grabbed a critical care nurse in the ICU, brought that person over, and they didn't have RRTs, but she basically called it. I ended up intubated, sedated in the ICU, woke up the next day. They didn't know that I was a clinical nurse specialist at the time. I woke up intubated and restraints, baby. Once they gave me that pen, I got to writing and gave them a new one. Told them who I was, what I know, what they didn't do, and who was to blame. And I was calling names, dropping receipts. This person didn't do what they were supposed to do as a clinician. I know because I trained critical care nurses and residents. So, long story short, I got to put all this fiery passion in this presentation with my clinical skills and knowledge, shared some stories, showed some pictures, and also shared that I too also found myself in a situation where, while I was a visiting daughter, went to visit my mom in the hospital, and I had to initiate the rapid response team because the med-surg nurses and the med-surg charge nurses didn't feel like it needed to escalate. They felt they had it covered. And long story short, they didn't. And basically, I called it, grabbed the ICU charge nurse myself, brought them over. They knew me and what I did. And they're like, oh, no, absolutely. Let's go. And, my mom's passed away already, but it humbles me and it makes me feel good to know that I was still there to help. Emotional. I was the one who grabbed the EKG monitor and put it on my mom. I was the one that grabbed the ambu bag from the crash cart to bag my mom when she was transferring to ICU. As a clinician, I get it, but as a daughter, shouldn't have to do that. But anyways, I'm not here to cry. I'm here to ask you to please watch the webinar. If you missed it, that's okay. You can watch the replay. You can register. You can get 1 CE for watching it after you complete an online evaluation, and just check it out. I really want to encourage you. I think this is where the conversation needs to start. Now, I know there are other things in the system that are influencing us from allowing us to do our best job, but when we know better, we do better. And the things that are missing, we got to press and step on the necks of healthcare leaders to say, this is what we need to do a good job so this doesn't happen to more patients. I need more nurses. I need more monitoring devices. I need this. I need that, so we can do what we need to do so patients don't suffer. When the patients suffer, we suffer. And let's keep it real. We're patients as well. We will be, eventually. So check out the webinar, Recognize Early Warning Signs of Clinical Deterioration. I'll put the registration link below. Also, 3 articles that I wrote to complement and support the content. Please make sure to check that out. And listen, I'm Nurse Alice. I'm always here to support, educate, and empower people to live healthier lives, whether my colleagues, whether my patients. I'm here for you. Talk to you soon.